Assalamu alaikum, everyone. Thanks for joining us for this discussion about something that is really important now. Thankfully, with the vaccination program and with people adhering to the safe rules, the original coronavirus has been contained. But as you know, unfortunately, globally, there's been the rise of a variant of coronavirus, which is the Delta variant. And we just want to utilize this webinar to have a discussion about this new variant, to see what it is, how did it come about, and how can we protect ourselves. So I'm delighted to welcome some of our guest speakers here. I will ask them to just quickly go around and introduce themselves.
Assalamu alaikum. I'm Dr. Ahmed Chowdhury. I'm a GP partner in Levens Hume and work with our stock as well. And I'm also a GP locum.
Okay, thank you. And then Dr. Usman Chowdhury.
Hello, assalamu everyone. Yes, my name is Usman Chowdhury. I'm a GP, portfolio GP. So I move around a little bit, but most of my experience is within urgent care, mainly in the Oldham and Manchester area.
Thank you. Dr. Bushra Chowdhury.
Hi, my name is Dr. Bushra Chowdhury and I'm a GP and I'm also the Vice Chair of ASTOC.
Thank you. And finally, Dr. Fazal Butt.
Assalamu alaikum everyone. I'm Fazal Butt. I'm a GP in Bury and like to hang around with these guys. Very nice people and they're guiding me along where possible. We're going to talk about COVID-19 and the vaccination and the variants and things like Delta variant particularly that's affecting us here in the UK. Just a few of the aims. Again, I may skip over some of these things. We've discussed them before and people are probably bored of them. But just the discussion about the vaccines that are available, that's a big problem, particularly in the BAME community still, even though we've really been pushing this and the variants we'll talk about and one or two things if we get time. So as we all know, coronavirus, COVID-19, different names. The proper name that is being suggested is SARS-CoV-2. It's a viral infection. The yellow writing there I thought is more pertinent really. It's 173 million cases. I was just updating these numbers before and we did a similar thing back in March and there was 2.6 million deaths. So from March to May, it's an increase of 1.1 million deaths worldwide, which is phenomenal, really, isn't it? Obviously, there was a big outbreak in India, which probably is part of those numbers as well. But that's a lot of numbers. In the UK, thankfully, this year we started to see a downward trend up until very recently, which I'm sure we'll cover later on. But there's still 126,000 tragic deaths. Each death is, of course, each one is a tragedy for us, really, isn't it? Minority ethnic people. So Black and minority ethnic people, what we're finding is we are disproportionately reflected in the number of cases and the number of deaths. So in the UK, possibly about 10% of the population is minority ethnic, and you'd expect 10% deaths, 10% hospital admissions, but it's more like 20-25%. So we're like 2.5 times more likely, it seems, to get the bug and get very, very poorly from it and even die. Some ideas have been mooted as to why that's the case. Why is it? Is it because certain jobs we do? It may be forward facing, taxi drivers, shops, seeing passengers and seeing customers, doctors, nurses, etc. Maybe the way we live. We can often find in Asian, Black and minority ethnic families, 2 and 3 generation households, grandparents, family, children, grandchildren live in the same house. Lots of mixing, meeting. Inequalities may be part of that, and I think we'll talk about that briefly later on. What is shown is that there's more minority people who have had died and more who have been admitted to hospital proportionally as to what we said. So actually we have the most to benefit from, yet we're still seeing a slightly slower, a sluggish uptake of the vaccine, which is a big concern. Okay, in the UK, these are the 4 licensed vaccines. The Pfizer, everyone's heard of that, Pfizer, AZ or AstraZeneca, and Moderna. So the Pfizer and AstraZeneca is mainly used in your local clinics. I work in Bury, Bolton will have the same. most of the country will. Moderna is similar to Pfizer, the way it's kind of made up, but it's being used for the big super centres, like the Etihad Stadium, the Manchester City Football Stadium, that the big super centre. They're using Moderna. Janssen's just been recently, I think, approved, but I expect it's going to come out towards the end of the year. I don't think it's knocking about, but that's a single dose. Of course, really important. The other 3 are 2 doses. You must have both doses to be fully protected. That's some spiel about how the weight works and stuff, which again, if we want to go into that more, we can do. It's just a bit technical, and again, a bit of a funny picture about, I don't know, wobbly things. I don't know what they are, but they're more about how the virus, how the vaccine works, and how you produce immunity, how it protects you. But again, if someone wants to go into it, they really can. We can discuss it later on. Some of the benefits of having the vaccine. Essentially, what we're seeing now is, of course, with some of these discussions, we took place towards the end of last year, beginning of this year, and we started up by vaccinating the most vulnerable people, the over 80s, and then the over 75, so our elderly and ill populations. And now we're finding the people in hospital generally are not over 80-year-olds, they're actually the ones just under 50. So 30s, 40s, 50-year-olds have been admitted. So it does seem like these vaccines have helped, because we vaccinated those 70 and 80-year-olds, 60-year-olds first, and now at the moment they are not making up most of the hospital population. Also, I was speaking to a doctor, and he was saying all of the people that are admitted at the moment for COVID on his hospital have either had 1 vaccine or none. He had no people admitted who had 2 vaccines, whichever one they had. So definitely they help. That's the bottom line. We're talking about herd immunity and etc., reduce spread. But bottom line is they help. If you don't end up in hospital, you're less likely to die, because obviously only the most poorly go to hospital. So that is how they will benefit us, by helping us become more poorly and reducing the spread. There's an issue about strains, new strains. Now, essentially the bug can change, and any virus or bacteria bug can change, but these bugs are known to change. They can sometimes change and become less aggressive. Sometimes they become more aggressive in the sense of they spread more, they're more spreadable, and these strains seem to be 50 to 70 times more spreadable. Now, if you remember at the beginning of COVID last year, we were talking about this bug being extremely spreadable anyway. We were washing hands and wearing masks and not meeting each other. So it was already unusually spreadable, contagious. And then these strains are even more spreadable. So it's a serious business. We have to be very cautious, and we shouldn't really let our guards down. Common side effects of any vaccine, really, kind of that list might cover them. If you have a travel vaccine or whatever, sore arm, whatever the vaccine goes in, can get tender. You can get a bit of a temperature. You can feel a bit fluey, a bit achy, headachy. Anaphylaxis means a very severe allergic reaction, and that isn't common. Guys, if you're not speaking, if you just don't mind muting your microphones, that would be really helpful. Thank you. So anaphylaxis has been an extremely severe allergic reaction, and that is very rare. I think I put there, it can be worse after the second dose. I think I probably put that in a few months ago. In my experience, it seems to be worse after the first dose. The second dose seems to be a bit easier, but again, you may disagree with that. And then blood clots, with a big issue about blood clots going on. The issue seems to be related to the AstraZeneca, the AZ vaccine. So up until about, I think the 26th of May, so about maybe 2 weeks or 10 days ago, in the UK, there's been 37 point something million AstraZeneca vaccines given out. Some of that is the second vaccine. So about 25 million people have had it. And some people have had only 1, some have had the full course of 2. Out of those 37 million vaccines in 25 million people in the UK, we've had 384 blood clots that have been identified. And that's these are not normal blood clots that you get like DVTs in the leg. These are rare types of blood clots. And of those 348 people, unfortunately, 61 people have died in the UK. Okay, so this was not the case when we did the last talk. At the last talk, I remember saying, but there's no evidence. At the time, the discussion was there's no evidence it's a direct link. You can develop a blood clot anyway, but now they say no, there is a link, but it's extremely rare. The numbers I put at the bottom is just some comparisons. If you're so if you took 1 million pregnant women, 200 of those women will develop a blood clot as well. So that's just normal, and of course we're not going to stop women getting pregnant. So if someone wants to get pregnant, go ahead, no problem. So it's 348 blood clots out of, and 25 million people. It's a very, very small number. Even though it is there, it's very rare. So we still wouldn't discourage the use of AstraZeneca. As I've just told you before, the benefits outweigh the harms. The variants. Okay, so the in brackets I've just put which country the variants were first identified in. Okay, and they've called them alpha, beta, gamma, delta. So alpha. So back in October, November last year, UK noted this first the UK variant at the time it was called. They call it now the alpha variant, and it seemed to be at the time it took over about 70 to 80% of by Christmas, 70% of the COVID vaccine, COVID infections in the UK were the alpha, that UK variant. So it came on the scene. It was very contagious, very spreadable, and it seemed to affect most new cases were alpha, the UK variant one. South Africa and Brazil had a similar problem. And this Delta variant that was first identified in India was obviously very recent, over the last couple of months. Now that clearly has made its way to the UK, and now about 75% of the UK new cases are actually Delta cases. So this seems to be more spreadable than the last one. It's almost like the more dominant, the more spreadable, it seems to kind of dominate the environment it's in. So now at the moment, the Delta variant is the key one. There's no evidence that if you get one of the variants, you're more likely to go to hospital, you're more likely to die. That isn't the case. As far as I'm aware at the moment, my colleagues may correct me if I'm wrong. It seems to be that it's more spreadable. So that's even more hand washing, even more mask, even more social distancing. I think there's been an unfortunate kind of a combination of factors. This variant's occurred. It's arrived in the UK. There was some reduction in the some easing of the lockdown restrictions in kind of April and then May, and now they're looking forward to do it in June. So more mixing, more shops, and then you've got areas where perhaps our Asian populations were higher. People were traveling back and forth from South Asia. All these things came together. Schools open again as well. It's been a very unfortunate, and I think that has, of course, added to these numbers going up. And I've just put the mutations, which is a natural change in this on the actual vaccine, and the difference. Sorry, let me go back. Alpha, beta, gamma, delta means they've changed in different ways. It's not the same change. The UK change of the COVID bug is not the same as the delta one. They've just changed. They can work out. Scientists know where the changes occurred, and that's why they know they are different mutations. But ultimately, they're all increasing the spreadability of the bug. It does seem the vaccines are effective against these variants, so that is good news. Some myths, I'm not going to dwell on this. There's been lots of stuff about this before. Is it halal, is it haram? There was a big issue then. I think we kind of countered a lot of that stuff. It was made very quickly. Government conspiracy theories. We can talk about them if you really want to. I think it's been really, poo-pooed. We've kind of hopefully got the message across that this is not true. Does it change your DNA, infertility, microchips, all of that kind of garbage? We know it's all rubbish. The clots was a question that I think has been answered. There is a slight increased risk of clots, but the other things, there's no evidence. What we should do, what can we do? Educate each other. Now, I spoke to one of the brothers, Brother Saeed from Bolton yesterday, and I was talking about vaccines and people not taking it seriously potentially. Some people saying, well, I'm young and healthy, I'll fight this off myself. And he was saying, well, those people need to come and see me when I'm preparing the deaths of the dead people in Bolton, and he's arranging the funerals. The numbers are just crazy. He said, I'm not stopping, I'm no time to breathe. And I think all of that needs to be borne in mind when people think, well, I can just fight this off, I'm young and healthy. And inshallah that will be the case, but that's not always the case. And I was hoping actually if he was on the call or somebody was, it would be nice to see what the experience of our colleagues in the masjids, in the other environments in social care, how are they dealing with it? We can tell you how GPs and doctors deal with things or how we are, but it would be nice to hear how you guys are, suffering, getting by, what your troubles are. Maybe we can try and educate each other. I think building trust in communities is very important. There's been lots of mistrust, especially around governments and things like this, and community leaders potentially. People have ulterior motives. I think that really needs to be worked on, and I think we've done quite well ish to counter these false stories that are going around YouTube and WhatsApp. We've done, certainly Astock have done lots of information about it, and others have too. Having clinics in more comfortable settings, in surgeries, in mosques and things. I'm actually doing a clinic in a mosque tomorrow for a Pfizer vaccination in Bury, where I work. We're hoping that will be successful. Other colleagues have done the same. We've had lots of videos of imams and trusted people having vaccinations, which I think has helped. Redressing health inequality, I think that is a really big piece of work. It may be beyond our scope here, but I think it needs to be identified. And I think it's really important that this doesn't go away. I was just thinking before, we all know about the Grenfell Tower issue happened a couple of years back. And I think at the time there was a lot of noise, and absolutely appropriately, about, what if that tower was in, Knightsbridge in London, would it have been a different scenario? And I would say most of us probably think it would be. What's happened with that story? It's gone very quiet. It's kind of not in the news anymore. I'm worried that this health inequality thing, lots of people can talk about it now, but in 3, 6 months, a year, 2 years, when hopefully the COVID bug has gone away or whatever's happened, things might go back to normal. And I think we're just going to be a disaster waiting for the next major, worldwide pandemic to start. And we'll be back in the same place. We'll be suffering again. So I think it's really important we don't let that happen. I'm not sure who the right people are, probably it's government level or whatever, but I think they need to be addressed. Thank you very much for that, guys. I'm going to hand it back to our chair, Dr. Inam, to take it forward.
This is an opportunity for anyone to ask some questions. We've also got some questions as well to ask the panel. Now, in layman's terms, what is a variant, and how did this sort of variant happen from the the normal coronavirus? How did this happen?
But we have lots of bugs around us all the time, and viruses, a lot of different types, including coronavirus. And there's some naturally occurring variation. They just change naturally. There's not always a reason for that. And it appears that this natural change that is expected, actually. And I think on my right at the beginning, I didn't really dwell on it, but there was a similar bug that broke out in China, in the China area a few years ago. Also one in the Arab countries called MERS, Middle Eastern Respiratory Syndrome, and they say that mutated. That bug, it wasn't as contagious as this COVID bug is. It wasn't as bad, therefore it kind of stayed locally in the Arab countries. But then it mutated to even less spreadable. So sometimes bugs do change. In fact, it's an expected thing. It can happen randomly. I think people were aware of it, so they were waiting for it to occur so they could take action. So it's not unusual for this to happen. The worry is that it's really speeding up almost. It's going into like from second gear to fourth gear, these mutations at the moment. But they are expected. It is not unusual for bugs to change in this way.
So it does sound like it's something called the spike protein. So on the surface of the virus that has been changed, and that means it survives better against all the risks that are there. So I think it's just an evidence again of how powerful the virus can be and how much it wants to survive. Despite all the measures we put in place, it will try to find ways to be able to fight what we can do. Thank you for that. So the next question is about, why is it called the Indian variant? Why is that the wrong terminology? And what should we be calling it instead?
The reason it's been given the name of the Indian variant originally is that when it was the mutated form was first identified in India, and we've seen how it's overwhelmed the healthcare systems there. So it should actually be named something not associated with the country. And one of the reasons for that is so that the countries who identify new variants in the future don't feel reluctant to come forward to be labelled as labelled with a name going around the world with a new variant of coronavirus. So the correct terminology is calling it the Delta. That's easier, and it also has a number, a B number as well, which is quoted in a lot of the scientific research papers. But we should be moving away from calling it the Indian variant.
Yeah, that's a really important point, especially what happened right at the beginning of the coronavirus, where in America, a certain president was calling it as the China virus and some other racist terms as well. I think we have to be careful, don't we, with the fact that this is a global pandemic, not to start labeling, start blaming different communities and different areas of the world for causing this. And I think similarly, there is a variant that's come from Nepal, which is affecting Europe at the moment. And again, we don't call it the Nepal virus, we call it one of these fancy letters and numbers names to be able to identify it. So I think that's a key message. If we are talking to our colleagues about this in our communities as well, let's get the terminology right, and let's move away from saying this is an Indian problem, or this is a Nepalese problem, or this is a Chinese problem. So thank you for that, Dr. Bushra.
I think it should just be pointed out as well, especially with the Indian variant. I don't think anyone should blame any communities, because I don't think anyone not followed any of the rules set out by the government. So I don't think any community should be blamed for that. If you're following the rules, it's the rule setters that should probably take responsibility for these things.
Yeah, I think that, thank you, Dr. Ahmed, because I think that is really important to know as well, and another key message. Unfortunately, in the world that we are at the moment in politics, it's quite easy to scapegoat groups and communities and say it is their fault for this happening. We were fighting it, and then this community did that. It's nothing to do with that. The virus does not look at, oh, I'd like to affect this community, and I want to cause problems there. The virus will take an opportunity anywhere, and it is more to do with the guidelines set nationally. So if the guidelines set nationally cause appearances of the variant by whatever means measures, that's the thing we need to look at as well. Thank you for that. I've got a question from the floor from Brother Muzahid Khan. Do we know how many people are hospitalized who've had the vaccine? Or are those currently hospitalized not vaccinated?
Last Friday, we were looking at the number of hospitalised people, and it was a case there was about 7,500 people were hospitalised in England with coronavirus, and there were 11 deaths. So in terms of the proportions that were vaccinated, I'm not sure out of those figures how many were vaccinated and not vaccinated. But if we look at the populations that we are seeing high rates of the new Delta variant, such as Blackburn and Bolton, and the vaccination rates, the vaccination rates are actually similar to other places in the country. So it's not a case that the vaccination rates are low in those communities. And we also know you need to have 2 vaccine doses to be protected, and we have a large proportion of our population with just 1 vaccine so far. So these are other factors that will be contributing to the rates. And also we know that the new Delta variant can also escape the vaccine, so you can still be affected even though you've been vaccinated with 2 vaccines, and contract the virus and transmit it also. So it's a different picture now. But those are the figures that I have, and I wonder if any of the panel have anything else to add with regards to the second part of the question. Thank you.
Thank you.
A colleague of mine was an anaesthetist, sent some data saying that the ICU admissions with COVID is a very slight increase last week in Greater Manchester. So it's early days, but we'll see how that's going to go in the future. But it was a very slight increase. So.
Certainly anecdotally, I spoke to one of our local consultants at our local hospital, and he was saying there's all of the patients that are admitted now, at least at the moment, this was just a couple of days ago, none of them have had 2 vaccines. So basically he's either got people with no vaccine or with 1 vaccine. They've not had the full course. He didn't have a single patient in the hospital right now who had had the 2 vaccine, which is really good news.
Presumably they're younger people. Is that right?
Yeah, at the moment, majority of people admitted to intensive care are under 50. But of course, previously it was really the 80-year-olds and the very elderly. In fact, the death rate was so high in the over 80s, wasn't it? So that seems to have really come full circle. And the only thing we really introduced since over the last few months is the vaccine. So it would make sense that the vaccines made the difference. We haven't really done anything else differently. We continue to, in fact, I would say, social distancing has gone down because we had a second lockdown in December. The vaccine didn't come out till the end of December. So the key thing I think we've done is vaccine. I think that was certainly anecdotally that will be the case. I'm sure the stats will probably show that as well.
Yeah, I mean, in terms of the figures as well, I mean, as Dr. Busher said, in Bolton, the levels are similar, about 67%, which is similar to the first dose in the UK as well, even though the levels per 100,000, that's about 424 per 100,000 people being affected by this Delta variant. So it's not because of, again, going back to that issue about the community, it's not because the community has chosen not to get vaccinated that this variant is happening. This is something that is part of the way that the virus survives. As you've mentioned as well, the vaccination actually helps, especially if you can get the 2 vaccines done.
Can I also mention, I work in Salford, neighbouring to Bolton, so very close, and we are seeing an increase in the numbers of COVID cases being diagnosed in Salford and a slight increase in ITU admissions. And we've been looking at our data and our local practices about the number of vaccines, and we have seen that there is a low uptake in certain communities from ethnic minorities, particularly Black African communities, and also we have seen that the women are more likely to be vaccinated, so we've got a decrease in the men and also ethnic minorities uptake, and the younger age group slightly lower uptake, but that's partly because we've only recently started vaccinating them, so those should go up. But also just to highlight the fact that those people are poorly less than 50, so it's really important that we get the less than 50s pushed through the vaccination program as quickly as possible, because we could see a similar picture and an increase in the number of cases in all the neighbouring areas because it is so highly transmissible. So it's 50 to 70% more likely to spread. So we thought coronavirus was contagious originally, but this is like supercharged now. So it really is a lot more dangerous in terms of picking virus. So the social distancing measures that we're all getting excited about being able to meet and see each other, but it's kind of making us let our guard down a little bit, and we need to be more aware of our safety measures.
Yeah, thank you for that, Dr. Busher. Yeah, I think that's a key point. I think all of us are completely drained now with this pandemic. I mean, it's been going on and on and on. It's like 15 months, 16 months of hell. We've unfortunately lost many loved ones, friends, family. It's taken a toll on work. A toll on our own mental health as well as those who suffered with the long COVID. And the problem is there's this variant that's come. So we don't want to be the party poopers, the people that are trying to dampen the spirit of the world, and particularly our local communities. But it is that important thing to be careful to make sure that we keep our families safe. We don't forget that the danger is not over. And I think, unfortunately, in the press, in the media, the message is we're not nearly back to normal now. And the danger is, if we drop our guard, we could end up heading towards another wave, the third wave. As our panel have mentioned, this is more transmissible. It means it's easier to catch. It's a younger age group as well, so the risks are there. Okay, so thank you for that. So how the question is now, although we put this dampener on this topic, we can stay safe, can't we? So, panel, what can we do to stay safe? Dr. Uthman.
Yeah, so thank you very much, Inam. I mean, I think you've covered some of the key points there, and I think there are a couple of things that we can do. I think number one is vaccination, and a lot of the evidence is suggesting that if you've had 2 vaccinations, you're, much less likely to become more seriously unwell. So the key thing is vaccinate, vaccinate, vaccinate. Number one. And number two is distance, distance, distance. I mean, I think the social distancing has been very effective. And, as you said, Inam, is that we're looking at kind of returning to some normality later on this month. That's the kind of government roadmap. But looking as we are, that doesn't seem to be the wise thing currently. And I think it's very important we don't lower our guard, that we, protect ourselves, our family. We're seeing an increased numbers in secondary school children, number of cases, in secondary school children. In my daughter's school, 10 children in her year, I've got COVID-19. So we're seeing this. It's obviously coming home to parents. So I think it's really important that we are looking after the whole family, ourselves, our children, etc. And one way of doing that is by maintaining the social distancing. I don't think we're out of the woods yet. And the other important thing that you said is, with COVID-19, this is a global illness. It's a global disease. And it's about every single person, whichever country they're in, to do their bit in reducing the transmission. The worry is if we don't, we pass the condition on to someone else, it spreads, a lot more lives are lost that way. So I think it's really important that everyone plays their part in reducing the transmission, and the social distancing certainly is part of that.
Thank you, Dr. Osman. Yeah, I think that's something we also need to bear in mind, don't we? The global nature of this disease, and it brings into question why in the West we're sort of looking after our own, vaccinating our communities, but neglecting the rest of the world. And this could be a reason why there is risks of variants and risks of continuation of this, because if vaccination is not being offered globally and universally, then we are at danger. And we need to start thinking of ourselves as a global community rather than this is the UK, let's protect our own. Because if we want to go on our holidays, we want to go there safely, visit family, friends abroad, we need to ensure that they're safe as well as us. And I think, again, not to get too political, but people have made decisions which are looking after their own community and not looking at the long-term implications of not getting vaccination done in key parts of the world as well.
I think this is a unique thing in humanity where protecting other people is few. So India, if it was helped a bit better, we protected ourselves a bit more. So you don't see that a lot in life generally, but it just goes to show that if you protect everybody else, it's better for us.
And she's got two questions. The first one is how we can stay safe from the new variant, and also second question is if you've had 2 vaccines, what are the chances of being protected against the virus? तो पहले जो क्वेश्चन आपने सवाल पूछा है तो आप पूछ रहे हैं कि हम कैसे सेफ रख सकते हैं अपने आप से और अपनी फैमिली को भी। आप ज़रूर अपने हाथ धोएं और सोशल डिस्टेंसिंग भी करें और मास्क भी पहने। तो सबसे बेहतर चीज़ आपके लिए और सब कम्युनिटी के लिए कि वैक्सीन का प्रोग्राम जो हो रहा है, तो 2 वैक्सीन ज़रूर लगवाने हैं। तो अभी स्मॉल एजेस को भी लगा रहे हैं, तो जो बच्चों को भी लगा रहे हैं। तो जितने ज्यादा बंदे लोग वैक्सीन लगवा सकते हैं उनके लिए, पूरी कम्युनिटी के लिए अच्छी है। और जो दूसरा सवाल आपने पूछा है, जो वैक्सीन, दोनों वैक्सीन जो हम इंग्लैंड में जो लगवा रहे हैं, एस्ट्राजेनेका और फाइजर, उसके साथ आपकी प्रोटेक्शन है। तो पहली जो वैक्सीन होती है, एक दफ़ा जो वैक्सीन होती है तकरीबन 30-35% आपका कवर होता है। तो उसके बाद जब दूसरा वैक्सीन लगवाते हैं वो तकरीबन 70-80% हो सकता है। ये भी बताते हैं कि सिर्फ वैक्सीन के साथ आप सेफ नहीं है, तो दूसरे मेजर्स भी रखने हैं। हम जब आप वैक्सीन लगवाते हैं, बहुत ज़्यादा लोग कॉन्फिडेंट हो रहे हैं कि हम कवर्ड हैं, लेकिन अभी भी आपको लग सकता है, लेकिन आप के चांसेस बहुत अच्छे हैं जब आप वैक्सीन लगवाते हैं। सॉरी, मेरी उर्दू इतनी अच्छी नहीं है, प्रैक्टिस भी नहीं हुआ कितनी देर के लिए, पर आपको समझ आई है जो कुछ मैंने कहा था?
Can I just add? शायद मैंने अगर मैंने गलत नहीं सुना, आप पूछ रहे थे कि वैक्सीन ये जो वेरिएंट है उस उनको असर करती है, ये आपने पूछा था शायद। दूसरी जो बात करें,
Thank
बिल्कुल
you.
मैं एग्री करूंगा कि सबसे बेहतर आप पहले जो कर रहे थे हाथ धोना, डिस्टेंस रखना, मास्क पहने, ये आप ना छोड़ें, बहुत
जी।
ज़रूरी है। और बेवजह किसी को मिलना, ये मैं फिर भी अभी कहूँगा, ठीक है उन्होंने लॉकडाउन ईजिंग की है कि घरों में आ सकते हैं, लेकिन जहाँ हो सकता है आप बाहर मिलें, ये बातें हमको करनी चाहिए। सब ये जो वैक्सीन लग रहे हैं, फाइजर का वैक्सीन या एस्ट्राजेनेका, दोनों, और मॉडर्ना तीसरा है, ये जो वेरिएंट है उनको भी आप उनके खिलाफ ही हिफाजती आपको, यानी कि आपको हिफाजत होगी, जो आपके फायदा का है। हाँ, जो इंडिया वेरिएंट है या यूके वाला, उनको भी फायदा देता है। तो ये आपने नहीं समझना कि सिर्फ पुराने जरासीम को अफेक्ट करेगा, नए को भी करेगा। आप जरूर लगाएं इस वजह के लिए।
As a quick summary in English, what is the advice about the vaccination?
So there is some coverage with all the vaccines against the new variant and the other variants that we know about. So it's important to get yourself vaccinated. However, all the vaccines are not 100% in terms of protecting you. So you still need to try and prevent getting the virus in the first place by using all the measures of social distancing, wearing masks, and meeting outside and not meeting large numbers of people unnecessarily. Even though the lockdown rules are easing, we still advise you to just meet the minimum people inside, and only if you have to, and utilize the nice weather and go outside.
Thank you, Dr. Bushra. So it's a good time actually at the moment because of the weather that we have that opportunity not to be stuck inside in non-ventilated rooms. I think that's the key thing, isn't it? Keep your windows open, keep your space. The coronavirus is airborne as well. It's not just about droplets. So you do need to make sure that there is this ventilation there. You're wearing your masks. In terms of where we see this variant heading, so we talked about how it came about, the risks of it, the fact that it's more spreadable and can potentially affect a younger population. As Dr. Usman said, it can affect our school kids and who can spread it to the younger population. Where are we seeing it from what the experts are saying? Where are we seeing this variant going in the next couple of months?
We're seeing a rise in the number of cases in certain areas, and that's not surprising seeing how contagious it is. So it's kind of expected that if you got getting pockets of people who are living in densely overpopulated areas, that there will be spread. To try and combat that, there's lots of education about the variants, but also a real push for vaccination and also testing. So there's lots of surge testing. So there's lots of centres in lots of areas where there's high numbers where people are being tested when they're asymptomatic, to try and identify and isolate those people to reduce the transmission rates, and also lots of work like Dr. Fazal Butt's going to be vaccinating in a mosque tomorrow, so really taking the vaccine to the heart of communities, to remove any barriers there are for people to not have the vaccine. So if it's in a place that they're familiar with, given by doctors they trust, like, and who they know, like Dr. Fazal, they're more likely to take it. So those are the initiatives that I know that we're trying to minimise the rates, but they are going up, so it is a bit frightening at the moment.
Thank you. Dr. Fazal, so you've been involved in the vaccination programme in your area. I mean, could you just explain to anyone listening sort of how they can attend such kind of these surge vaccination clinics?
So I'm not one of our clinical directors or the CDs of the area, so I'm not responsible directly, but you know, where we can help out our communities, I think we will. I'm sure all of us are helping out in different ways. So we've just we asked our local health authority, Bury CCG, if it's okay to set up a couple of clinics in. We did 2 in community centre called Jinnah Centre in Bury, and tomorrow, inshallah, we plan to do it in Nurul Islam Mosque. So if you're a Bury resident over and you're in one of the eligible criteria, you're welcome to come down for your first Pfizer vaccine. So obviously these things have to be planned. They're complicated to plan them. They have to be safe. They have to be, you have to have the right number of people there who can mix the vaccines, and everything has been done in a certain way. Infection control, CQC needs to be involved, and they have to be informed of the site. So it's not so straightforward. There's a lot of work in the background, and thankfully, Asif, my manager, has been absolutely instrumental in setting up all the clinics, to be honest. The way it would work would be if you're eligible. So let's say you're a Bury resident, you're 24, and you're well, yeah. If you have things like diabetes or other illnesses, you probably should have already been vaccinated. But if you haven't been vaccinated, you're welcome to come down to the walk-in clinic. We can have a limited number of vaccines, several hundred, so it's not just a few, and it will be first come, first serve. So I'm well aware of other friends of ours who have done huge clinics with 5,000 vaccines over a weekend in football grounds and other community centres, churches, mosques, etc. So lots of initiatives going on. You need to keep an eye out for your local press, your local health authority, NHS web pages in Bury. It'll be on the Bury Council. Are also involved on their web page. But essentially, if you're eligible, we need some sort of proof. If you're 18 or something like that, we need some sort of driver license, something to make sure you are eligible from an age perspective. If somebody wants their second vaccine, then it's really important to bring along the card you got from the first vaccine, because at the moment we're not in a position to mix the vaccines. I think we didn't mention it before. So if you've had AstraZeneca, you have to have second AstraZeneca. You cannot have Pfizer. And equally, if you have Pfizer the first time, you must have Pfizer second time. At the moment, it's not being licensed to mix them. Maybe that will change in future, we don't know. So we'll need your card. On your card, it will say the date you had the vaccine and which one you had, because I will need to confirm I'm not mixing them. Equally, previously it was like you repeat the vaccine after 12 weeks. It's now been reduced to about 8 weeks. Yeah. 8 weeks minimum. I think if it's a couple of days either way, we'll use our clinical discretion. But essentially 8 weeks. If it's been 8 weeks, we need to see the date on your card, the vaccine you had. If it's Pfizer, we'll give you the second one. Otherwise, we're trying to get the first Pfizer vaccines in. It's pretty straightforward. I've worked at a couple of other clinics in Prestwich, for example. They're very well organised. There's marshals. The weather should be good, so at the moment it's not a problem about rain. But they're distanced outside. You'll come in, you will check in. We have people there checking on your details onto the computer. And make sure it's the right patient, because you have to send the information to your GP. That's all has to be done electronically. They have doctors, they have nurses, they have pharmacists doing the actual injection. Of course, we'll explain how the vaccine works, or if you have any allergies, if you're on any medication, blood thinning medicines, etc. All of that will be asked. You have a vaccine. With the Pfizer vaccine specifically, it's really important that we keep you for 15 minutes. So we're going to have a separate area tomorrow at the mosque, obviously large areas in the mosque, where we're going to sit people for 15 minutes to make sure they don't have a bad reaction. After that, you're welcome to go. So that might be your experience. You'll come in, there'll be a queue, you'll fill in some documentation to make sure you're eligible. They'll check your temperature, etc., make sure you're well. They'll come in, put your data on the computer, you'll have your vaccine and wait 15 minutes. And after that, you should be going home. So I don't think it's anything, it should be a pleasant experience. We hope we're going to try and make a pleasant experience. And all of our colleagues have been working really hard, having marshals. And these are volunteers, by the way. People are taking out their time for several hours in the day to help, if there's a queue towards a road, make sure it's safe, helping people fill in forms, people who are struggling to stand, maybe getting them chairs, all of that. And it has been a community approach in most areas, and in fact, I'm sure all areas. I don't really see why it will be different tomorrow. So, that's just a bit of my experience of these clinics anyway. And it is limited. There's a lot of people out there and colleagues of ours who have done thousands of, literally tens and tens of thousands of vaccines, and have done an absolutely marvellous job.
Thank you, Dr. Faisal, and I hope it goes well tomorrow, because hopefully, inshallah, that will make a massive difference to that community as well. I just wanted to, just towards the end, drawing Dr. Usman, because Dr. Usman is one of the trustees at the mosque, and he's been involved in raising awareness there. I just wanted to ask those people that are concerned with this variant and attending places of worship and things. What kind of reassurances can you give about attending places of worship?
Yeah, I mean, I must say that mosques have really been excellent in managing social distancing. I mean, very strict. So I think Cheadle's similar to many mosques up and down the country. So as people come in, everyone's wearing a mask. Everyone has their own prayer mat and brings in a shoe bag. And then when they go to the prayer area, after checking temperature and making sure that's okay, they come to the prayer area, and there's a 1.5, 2 meter distance between every individual. And within the prayers, as we've been doing since we've been open, the prayers are kind of kept short. Essentially, people come, they pray in congregation with the distancing, with the masks, with their own prayer mats, and then as soon as the prayer is done, they move outside. So in terms of social distancing and maintaining safety, I think places of worship are done very well, actually, and respectfully comparing to other places where people congregate, whether that's in retail or hospitality sectors. I think we're very strict and regimented, and in fact, maybe it's easier for places of worship to do than other places such as hospitality or in retail. So in terms of the question, Inam, yes, I think people can be rest assured coming to places of worship, they are maintaining, your safety. Obviously, the sensible things we mentioned before is, when you're meeting people there, we continue not to shake hands. We continue to keep our distancing. We meet outside. If you want to, meet someone, do it in the car park. Keep it brief. When you come home, wash your hands, etc. So all these sensible things that we just need to keep on doing. But yeah, I would say that people are probably as safe as anywhere coming to places of worship.
Thank you, Dr. Usman. And hopefully that will reassure those who are worried that they can't attend their places of worship. It sounds like there's throughout the country, with different faiths, everyone is making that effort to keep people safe there. And I think that's really important for people's spiritual side of things, especially during a difficult pandemic, that they have that chance to worship appropriately as well. Okay, we're coming to the end. We've only got 3 minutes left. So, first of all, I'd like to thank our panel, so Dr. Usman, Dr. Ahmed, Dr. Fazal, and Dr. Bushra. As a final point, I want to ask Dr. Fazal a final take-home message about the variant, a final take-home before we finish today.
Okay, so I'd say a couple of things. One, I think it's been emphasised, let's not blame any community. We're all in this together. I think the vaccines are effective against the variants, so please don't let that put you off having the vaccination. The evidence at the moment seems to be the elderly people who are first vaccinated are not ending up in hospital, so it's working. So let's please do that. I think it's really important. Let's not let our guards down. I know we are able to mix, but let's still be reasonable and sensible. Wash your hands, wear your masks, keep your distances, and I think that's what's helped us get to a position where generally the rates are coming down, and I think that will continue to get us out of this mess, and inshallah it'll be okay in the end.
Dr. Fazal, very wise words there to end today's webinar. So, thank you for your time, everyone. Assalamu alaikum.